Hi, and welcome to our informal debate. We have the topic of the standardization of evidence-based treatments and ethical necessity. And my name is Alex Stanfill. I'm from Fayetteville, Arkansas, and I'm going to be acting as the group's introducer, summarizer, researcher, and illustrator of claims in support of the standardization of evidence-based treatments. Emily Ritzema will be acting as a summarizer, researcher, and illustrator for additional claims in support of the standardization of evidence-based treatment. And Hannah Vollenwater will also be acting as a summarizer, researcher, and illustrator for claims in support of the standardization of evidence-based treatments, as well as counter-arguments to the group's position. All members acted as fielders. So let's get started. The diagnosis of autism spectrum disorder has been increasing for decades. According to Stammer, 2014, special education enrollment for children with autism in the United States has quadrupled since 2000. This, along with the fact that ABA is a relatively new treatment for ASD, has resulted in improper treatment and interventions being carried out on individuals with disabilities due to the shortage of effective ABA services available to help them and to help them reduce the symptoms that occur with autism. All right. Horrific abuse and maltreatment of individuals at the hands of professionals belonging to the field of ABA during the early 1970s. This highlights just how far ABA has come in a very short amount of time. One popular example is the Sunland, Miami scandal of 1972. And what happened here was a doctor that was not using evidence-based treatments. He was actually using really horrible treatments and punishment techniques. He was having some of the residents engage in public sex acts if they were caught engaging in activity like that outside of the public eye. He brought that and made them do that in front of people. He forced soap in people's mouths. Just really horrible stuff. And that was operating under ABA. So what resulted from the investigations that went into the Sunland Miami scandal, it fueled the generation of the BACB's ethical compliance, professional and ethical compliance code. And we got to move away from that to evidence-based treatments. Our position is that evidence-based treatments ensure individual safety. With the internet, that's enabled people to be able to get a lot of misinformation on basically anything. The same is for autism treatments. There's many techniques that are solicited to parents to make money. There's some that are really bad for you. So some that we have listed on this screen are the chelation therapies, stem cell injections, bleach consumption, and bleach baths. There's a $300 book that you can buy, and it claims that if you read it, you will cure your child's autism. And obviously, these are not evidence-based treatments. And this is a growing concern on the internet with desperate parents that do not have access to ABA treatment. They're looking for anything that they can to help their children. So the National Standards Report 2.0, with the mass amount of false advertising and misinformation concerning treatments and cures for ASD, this is a significant threat to our society and the children that aren't accessing proper care. There's an obvious need to distinguish between evidence-based and non-evidence-based interventions, and this is what prompted the National Autism Center to design the National Standards Project. And this project publishes what is called the National Standards Report, and this gives educators, parents, practitioners, and organizations the information that they need in order to make informed choices about effective interventions for individuals with ASD. Phase 1 was published in 2009 and examined research supporting interventions for persons with ASD under age 22. Phase 2, published in 2015, updated Phase 1 literature, and for the first time it included and evaluated the interventions that can be used for individuals that are 22 and older that are on the ASD spectrum. And then Phase 3 is set to be published in 2021, which is very exciting, and it's going to include all of the evidence-based practices and emerging treatments for research that's been conducted through 2018. So currently there are 14 evidence-based procedures and 18 emerging treatments listed in the latest NSR. These treatments demonstrate effectiveness, but there's still not enough evidence available for them to be listed as evidence-based practices yet. So according to Cooper, Heron, and Heward, an individual has a right to a therapeutic environment, services whose overriding goal is personal welfare, treatment by a competent behavior analyst, programs to teach functional skills, behavioral assessment, and ongoing evaluation, and the most effective treatment procedures available. Code 2.09a of the BACB Ethics Code states that clients have a right to effective treatment based on the literature and adapted to the individual client. Behavior analysts always have the obligation to advocate for and educate the client about scientifically supported, most effective treatment procedures. Effective treatment procedures have been validated as having both long-term and short-term benefits to clients and society. According to Bailey and Birch, the establishment of an individual's right to effective treatment protects the personal welfare of the clients, as they have a right to be treated with the most effective treatments available. We argue that a standardized approach to the treatment of ASD would improve individual outcomes and reduce potential harm to clients through the use of non-evidence-based interventions. And further, we believe that when evidence-based procedures are taken and adapted to the individual client, we are adhering to Code 4.03, which states, behavior analysts must tailor behavior change programs to the unique behaviors, environmental variables, assessment results, and goals of each client. According to Stammer, the diagnosis of autism spectrum disorder has quadrupled in the past 20 years, and with the rise of individuals being diagnosed with ASD, we argue that this has created a concern for our society because there is a growing subpopulation of individuals with ASD entering into the community where there is little to no support in place to aid them in acquiring essential evidence-based treatments. The standardization of evidence-based practice in ABA for individuals with autism can ensure that financial resources are being reserved for the most effective, socially valid, and evidence-based practices at community and individual levels. From a political point of view, we argue that both local and federal government should adopt national standards of practice for the field of ABA when providing treatment interventions to the ASD community. We argue that when evidence-based procedures become publicized and used effectively, this will enable our society to shape public policy concerning ASD and its intervention through the development and dissemination of national standards of practice. National standards of evidence-based procedures would also help to ensure that individuals living in our community have equal access to effective treatments. And we have listed here the ABLE Act of 2014, and that is a tax benefit for people that have autism and other disabilities. That's just one way that some legislation has been pushed through to advocate for people with disabilities. And there was a passage of autism insurance legislation, and that can mandate that the effective treatments are used first.
Hi, my name is Emily, and I'll be talking about professional and ethical dilemmas. According to Code 209A of the Behavior Analyst Certification Board Ethical Compliance Code in Treatment and Intervention Efficacy, it states that every client has a right to effective treatments. Those treatments are to be based on research literature, as well as having adaptations made that fit the needs and behaviors of that client. In addition, the BCBA Task List 5 explains that practitioners must use the best available practices. Smith points out that research must demonstrate that an intervention procedure or contributes to producing a socially important outcomes that would cause the consumer to say that the problem is solved. We argue that practitioners must provide treatment that is shown to have a positive impact on the client's life and help them solve a problem that would otherwise go unsolved. Ethically, practitioners should only use evidence-based practice, but that's not always available. And that's where the best practice available comes into play. A counter argument for this would be that evidence-based community standards affect scientific freedom and can frame the use of punishment or the use of aversiveness as unethical when in fact, if done correctly, it can be carried out in ethical ways that greatly benefit the individual. One more.
Okay. We're gonna have to stop. I don't know whose slide this is. It's not mine.